microphone. Hi, Mr. Edwards. Hope you remember me still. Hello, everybody who's sitting in class there. Went to Mount St. Mary's College and earned my bachelor degrees in 2008. I've been a nurse for approximately 4 years right now. I started off nursing and went directly to cardiothoracic ICU at UCLA Medical Center. I am currently a part-time at UCLA, still working as a nurse, but 2 years ago I applied for grad school, and right now I'm in grad school at Kaiser School of Anesthesia. I went directly to cardiothoracic ICU because I started off doing a care partner job and I was a secretary in the unit. The minute I walk into that whole environment, it gives me adrenaline, and I wanted to be exactly what those nurses is, to be able to care for the patients, to do the assistive device, whether it's a ventricular assistive device, VAD. This is just for patient who does transplant to a bridge to transplant to get a new heart, whether it's dialysis. I wanted to be like those nurses who's capable and able to do all the machineries. After about a year and a half in cardiothoracic, I applied for grad school, which is a specialty certified nurse anesthetist at School of Kaiser. Out of about 700 students that applied, they took 30 people. I was very fortunate that I was one of those students that they picked. And I went into that field because I wanted to do some kind of specialties that I think that I can give back. Roy's model is very practical. I think I would say another word. And most of all, what I've learned in this school is all the teachers who stood behind me and who believe in me and never give up on any of the students and lay that basic foundation. And this is what we all need. You know, you don't need to be the best nurse. You don't need to have any of the other skills, because we can all learn that. As long as you have the basic foundation, you can grow. What do I love most about nursing? First of all, money. Just kidding. I know we all look for money. We all need money. But nursing gives you a way to be with other people, to be able to help other people, to have that relationship with your patients, to be able to give back to the community. And that's what I love. Also, nursing, you can do a traveling job, you can do anything, you can go any specialties that you want. If you don't want to work ICU, you can go to ER, you can do med surg, you can do labor and delivery, you can give anesthesia. There's so many specialties and varieties that you can choose from, and this job is pretty stable as long as you don't do anything wrong. So the advantage of nursing is that you can always come back to teach. You can go for your advanced practice nursing. It's pretty much a career that you have the job security, you can travel if you want, and those are some of the advantages that you can choose from. The disadvantage is that I think about, number one, don't get too burnt out. Usually when you graduate from nursing school, you start a new job, you see the money, you want to work 7 days a week, and that's not good. You get very burned out, you will get stressed. So I advise to you, just take it easy. I have a student that asked me, is nursing an art or science? I think it's both. And as my profession right now in nurse anesthesia, it's like an art. For me, it's like cooking. You tailor your meds to your patients. So it's not individually set that I have to give this patient a certain set of medication, or this much amount of intubating dose will work for this patient. So that's kind of like an art. You kind of manipulate your own style. You tailor things to your own needs. In a way, in a science, you need that science background to be able to incorporate and know the pathophysiology to each patient, because without that, you can't practice. So I think it's a little bit of both. My last advice to you guys, good luck, keep positive, don't party too hard, and you're at the bottom of the sardine there, so take it. Whatever you do, it will pay off. Once you become a registered nurse, you can do anything you want to do.